Welcome to Uncaged. Today we're speaking with Alejandro Rodriguez. Alejandro is the CEO and founder of Epiq MD, and he is really taking charge and trying to really solve some of these complex health issues that we see in America. It's a convergence of primary medical and mental health care, preventive care, and wellness programs. It's a digital platform in a single offering. So Alejandro, I'm excited to see what we're doing at Epiq MD. But before we get into that, love to know a little bit about you and your career.
Yeah, sure. Absolutely. Thank you. And interestingly enough, my background is not healthcare at all. I started in the utilities business, in telecom, and then I transitioned into power, natural gas. And I've got a 20 plus, 24, 25 years of utilities technology type of experience. I've traded and bought and sold and marketed electricity, natural gas, across the entire coast. And that's what I've done. And I was working on a project that ended up, being at a standstill during the pandemic. It was a new project that we were getting up and running. And the pandemic started, so we said, we'll just wait a couple of weeks and for the shutdowns. And of course, a couple of weeks turned into a month, and month turned into months. And by August, September of 2020, I was, doing nothing, ruining my health, just staying at home, doing nothing, twiddling my thumbs. Yeah. And I began to experience and see a lot of my friends, childhood friends, their parents, uncles, and some of them, even them at their age, were being dealt with really heavy blows from the coronavirus. Yeah. And so I just had a lot of time on my hands. So I began to do a lot of research, and a couple of things began to stand out for me. I'm Latino of Native American descent. So, if you were Black or Latino, you've got a 200 to 300% greater chance of dying from COVID. So that stood out for me, Yeah. And as I began to just take a deeper dive into the importance of wellness, because as we know now, but back then there was information everywhere, and a lot of it was wrong. And today we know a lot better. But I began to dig really deep, and it became very apparent that if you were well, you had a great chance of coronavirus being nothing for you. Yeah. But if you were living with a chronic disease, then it was an issue. So yeah. I think one of the things that came out of the pandemic is that the need for wellness was underscored. And again, coming from the energy industry, nothing to do with healthcare. I just, as a businessman in general, as an entrepreneur in general, I know the healthcare system is archaic. I know it's always 20, 30 years behind, and there's no such thing as customer service. So I just began to put all these things together, and a part of me felt that there was a need. Yeah. I'm kind of I think I'm naturally kind of mission driven. And in the energy industry, it's very transactional. It's not, you have ratepayers and counterparties, and so I really wanted to do something different. So that was kind of the begining of it.
To be honest with you, Alejandro, I love the story. It's a great example of good things that have come out of the pandemic, really, where kind of that insight, that experience has led to action. And so now you formed Epiq MD. Tell me a little bit more about the story of Epiq MD and what you and the team are offering.
So one of the other things, the need for wellness was underscored. And then the other thing that I began to come to grips with is there were approximately 84 million working Americans that have no health insurance or are underinsured. Right. And underinsured means that they had to check a box to avoid being penalized, and they got the cheapest option out there. But what happens with these people is when they actually have to use it, they don't realize that it's such an unfavorable plan. They can't even afford to use it. So they end up rushing themselves to an urgent care for an earache or a sick baby or something like that. So that was 84 million working Americans, not people destitute. If you're below the federal poverty level, you actually have options. but that single mom that's working two jobs in the restaurant industry or in the service industry, or the blue collar working family, middle class, even upper middle class is at risk of falling.
I mean, honestly, Alejandro, I'd say almost everybody.
Yes.
The reality is that the healthcare system is so broken at this stage that, even use myself as an example, if I travel and I get back and I have a couple of hours before I'm on to another flight, the only choice I have is to go to one of those minute clinics.
Yes.
Really?
Yeah.
Right?
No, it's true. Yeah. It's, and I'll tell you, it's not just the healthcare, the providers, hospitals, that's obviously archaic, but the health insurance business as well.
Yeah.
Health insurance rates, the inflation rate or the growth rate of health insurance has outpaced living wages by about 300% over the past 20 years. If a carton of eggs would have followed that same trajectory, we'd be paying $70 to $80 for a carton of eggs today. So it just,
well, that's a horrible idea. That's a horrible idea. Let's not have that. So tell me a little bit more about what, in fact, actually Epiq MD is doing.
So I wanted to be able to provide access to doctors, urgent care, even primary care. I also wanted to be able to provide access to mental health, life coaching, and anything else that had to do with wellness, right? Mm-hmm. Chronic disease prevention, chronic disease management. 6 out of 10 Americans live with at least one chronic disease. I mean, they have more than one. 6 out of 10 Americans. So I really wanted to create a platform that can accommodate all of that. And Epiq MD is the convergence of urgent care, primary care, mental health, life coaching, and wellness, nutritional advice, any kind of advice that you want to talk about. You can seek any medical expert on our platform. So I wanted to create a platform that had a seamless customer experience, easily accessible and affordable. And that's what Epiq MD is. And
I sign up, I just go to the website and provide kind of insurance, or how does it work?
No, that's a great question. So everyone automatically assumes that we're insurance, but we're not. We're a services provider. We don't fall under the same rules or regulatory guidelines of an insurance company, if you will. Now we are regulated, obviously, through all sorts of HIPAA compliant, HIPAA requirements and things like that. And we do, and we by all best practices. But we do have a direct to consumer model. So anybody can go to our website, epiqmd.com. Epiq is spelled with a Q, and you can enroll right there. Pick your plan, you enroll like anything else that you would purchase online. And then there's an onboarding process. We'll walk you through the onboarding process. You have access to your own customer portal, and everything is there for you to utilize. We also have a B2B practice. So we go after employers so that they can provide this service to their employees.
Excellent. Excellent. And I like the Epiq MD. I like that. I like the Q. So, it's an interesting moment in the healthcare space because we all went through this moment together, probably the most important moment in our lives, certainly as a collective, I'd say global community. And it's really changed people. It's also reshaped healthcare. It's left kind of tons of legacy issues in healthcare. Where are you seeing we are these days? I mean, what does the landscape look like right now?
That's a great question. And I don't know, my personal humble opinion is that I don't think it's a fixable. I don't think you can ever get that genie back in the bottle. It's too far gone. I think what we're going to have to depend on is, certainly government subsidized programs are always good, especially now. I think there's a lot of needs out there that you've got to take into account, but it's going to depend on innovation. Yeah. And telemedicine has been around since the 1980s. It's always been there. But this event that happened to us was a catalyst to really take advantage of what it does. And what's happened with people, the consuming public, is they're forever ruined for the ordinary. They don't want to go back to the normal. Why do I need to go back? If you don't have a primary care, which is 100 million Americans is the estimate that don't have a primary care physician, it's going to take you on average 27 days to get an appointment with a doctor, to spend 13, 14, 15 minutes with that doctor.
Incredible.
It's broken.
That's crazy.
I don't know that it can be fixed. I think it's up to companies like Epiq MD and other companies out there to be innovators and to really just have consumers take their health into their own hands.
I'm such a believer in telemedicine. It's incredible that we still find it facing, I'd say, some roadblocks. I mean, one of the things that happened to me is, I split my time between Miami and New York City. And, a lot of my doctors are in New York, and somewhere during the pandemic, they're like, yeah, sorry, can't do telemedicine anymore. I guess there's like a new law saying like you can't do it across borders and things like that. And that are across state lines. And you can see those are like barriers that industries are setting up, right? To protect themselves. But the benefits of telemedicine are so obvious. I mean, so obvious. And so I'm really excited about the fact that you guys are building out a powerful solution in the space. But I mean, Alejandro, I know that you've built other businesses. You are certainly a serial entrepreneur, and you're tackling another big, hairy, audacious task here with Epiq MD. What drives you with these?
Like I said earlier, my own self being a Latino, Native American descent, I don't know if you're familiar with the term insulin resistant. Insulin resistant means that you're prone to be a diabetic. As a kid, I mean, as a 7, 8, 9-year-old kid, I was insulin resistant. Now, in those years, nobody knew what it meant. There was no such word. Nobody used those terms. And you couldn't know, people didn't even know what pre-diabetes was. But I had a condition that we know today is one of the first signs that you're pre-diabetic. If you see a kid with the condition that I had, you automatically know. But in those years, doctors just did not know. I had this condition. We went to every doctor. Well, I had no idea I shouldn't be eating carbohydrates. I had no idea. I'm eating what all the other kids in my family, in my neighborhood would eat, but I was gaining weight at such a rapid rate. And my mother and I were both like, man, what's going on? And I was very active. I played every sport. I worked at, physical labor. I did everything you could do. And I was still always this husky kid. Well, as I entered the workforce and I got more and more successful, which meant longer hours, I just began to put on weight. So over my adult time, I ballooned up. I was 350 pounds before I knew it. And then it just became more and more difficult from there. So I had lost a lot of weight in 2017, but then I started to gain it back. Well, during those first 7, 8 months of the pandemic, Bant, I ballooned. I was 485 pounds. And I said, you know what? I'm not gonna die like this. This is ridiculous. And now by this time, I had already invested so much research. So I knew I was a full-blown diabetic. I had heart health issues, everything you can imagine. I always call obesity the cornerstone chronic disease, because if you're obese, which 48% of our country is obese right now, if you're obese, you've got other issues. You were a diabetic, or you're on the way, you have a heart health issues, blood pressure, hypertension. So I said, I'm going to make myself the guinea pig and take control into my own hands. So, I've dropped 220 pounds. I have no more diabetes. I have a normal A1C count. Heart health is great. All the blood markers are phenomenal. And I just put myself on a mission. I also, mental health had a lot to do with it. So I knew how I am. I couldn't stay in the energy industry and do this. I had to completely create a whole new ecosystem. So it was a little bit selfish, but I also, when I look out there at where our nation is, 70% overweight, 47, 48% obese, 6 out of 10 Americans living with a chronic disease. That's not fun. It zaps you of your peace, time from your family. You're not operating at your full potential. And for me, this platform is about making wellness the gold standard and helping people to get on that track and lead their most fulfilling life. So, but I'm really about that. That's really
more, honestly, more power to you, Alejandro. I mean, what an incredible story. And certainly, as someone who, what I often say is I was looking at the scale and realizing that I was about as heavy as my favorite NFL linebacker. And that was the moment where I went, this is not good. This is not good.
And different body composition.
Different body composition and no ability to catch a ball. So there you go. But, it's something that we do need to tackle. And, I think it's on so many levels. It's about making sure that we provide wellness and complete and kind of this holistic idea that you're highlighting to all communities, everybody. I mean, you talked about underserved markets like the Hispanic market, African-American markets. There were horrible stories during COVID about African-American communities and how they were struggling to get people care for a variety of reasons. And, we do need to make sure that these solutions get out to a broader audience. So more power to you. So listen, Alejandro, as we look forward here into 2023, it's been an interesting year, certainly a year with some economic challenges for sure. But, what is on the docket for you and the Epiq MD team?
Well, we're in the process of rolling out two things right now. One of these is a more robust primary care product. So this is the ability for a customer to actually have their own dedicated physician, dedicated, that they have a custom care onboarding process. They get an annual wellness check, a full metabolic panels included in the price. And it's full-blown virtual primary care, very affordable for an individual or for a family, a household. And we are about 4 weeks away from rolling that out. We actually already have clients ready to onboard with it. So I'm very, very excited about that. That takes what we're doing today. It just takes it up a complete notch, and it's really bridging that gap in a major, significant way.
That's amazing.
The other thing that we're working on is we've been working with this company that's created a really beautiful and innovative facial scanning technology, where they do a facial scan and you can begin to get all sorts of blood marker readings off of the facial scan. So they've got a phenomenal technology, Israeli company. And so we're really looking forward to integrating that into our platform, so all of our customers could, utilize that scan once a week or once a month. We'll figure out how to productize it, but that's also a game changer, because that's bridging the gap from, peripherals, diagnostic devices, that are not in the home, easily accessible in the home, blood pressure cuff, things like that, the blood glucose level. So I'm really looking forward to that. Those are big, big things on the horizon. And I think those have the ability to really significantly improve the quality of life for people.
Well, I'm really excited about what you're working on, Alejandro. And I know you mentioned it before, but if someone wanted to learn more about what you and the team are working on, where's the best place to reach you?
Well, epiqmd.com, epiqmd.com. All of our information is there. We also have a very robust LinkedIn page. We're always posting fresh content, good articles, good data on LinkedIn. And I am very, very active. I'm active in all aspects of our business. My email address is alejandro@epiqmd.com. And I'm always available, very transparent, easy to interact with. And if you've got a project or something that you need to overcome, or you want to implement a wellness initiative for your business, then we're absolutely ready to be your partner and make that happen.
Excellent. Well, Alejandro, thank you so much for being on the Uncaged show today. And just to repeat that again, it's epiqmd.com, epiqmd.com, but with a Q in there. And we've been speaking with Alejandro Rodriguez about Epiq MD and really the business that he's built, driven from his experiences during the pandemic, but also kind of maybe targeting some of the issues that we've had for a long time in this country and trying to find some good solutions, lasting solutions for problems that have faced us for ages, So thank you so much for being on the Uncaged show today, and we look forward to having you back.
My pleasure. Thank you so much, Ben.
Cheers.